Good morning, Las Vegas. Healthy Las Vegas is now Healthy Nevada. We've changed our name because we're growing. Our demographic and our services and resources are now statewide. And one of the biggest reasons for that is that First Person Care Clinic is now First Person Complete Care. And First Person Complete Care is now a federally qualified healthcare center, which means I get to join officially the other 6 federally qualified healthcare centers in the state of Nevada, offering phenomenal services, high quality, reasonable prices, and lots of resources to the entire state. And I really think it's important that the people in Las Vegas, Carson City, Reno, Elko, Tonopah are all aware of the services that are available to them. So now we are going to bring in people from all over the state to talk about the wonderful resources, services, and high quality programs that federally qualified healthcare centers have to offer. One of the big areas, and you'll be hearing this buzzword a lot in the next, probably year to 2 years, is patient-centered medical home. Patient-centered medical home is a terminology used for medical clinics that have gone above and beyond taking care of their patients, not just the mandatory high-quality medical care, but to make that patient feel like they're getting all the resources they need. So we're talking extended hours. We're talking language lines for any language barriers so that people are understanding their resources in their native language. We're discussing with them different value groups. We're talking about patient outcome. So not just seeing the patient, giving them a pill, and taking care of whatever their aches and ailments might be, but actually putting together a strong program that the patient can participate in that will help them lead a healthier life, and then pass that on to the generations in their family, whether it's grandma and grandpa, aunts and uncles, mom and dad, or the kids. So this is really where healthcare is moving to, much faster than I think people are aware of. So federally qualified healthcare centers are not mandated, but they're very strongly encouraged to become patient-centered medical homes so that it is what it says. You feel like your medical home is that clinic that's providing you with all the resources that you could possibly need to lead a healthy life, and also to collaborate with all the other wonderful resources in our community. So let's think about that. At First Person, we have care coordination teams. So if my patient needs to see a urologist or an OBGYN or a cardiologist, we offer these services in a couple different ways. One, we actually collaborate with those specialists out in the community. So we've gone out of our way to make sure that we've built solid relationships with these people, these providers actually, so that our patients, when they go in there, the provider's aware of all their health information, their background information, and what we're looking for as far as services from them. They, in turn, give us a comprehensive report back. So now our patient gets the full loop. We send them to a specialist. That specialist sees them, works with them, and then lets us know so that as a team, specialist, provider, and patient, we can take care of that patient and make sure that they don't fall through the cracks. That would be an example of patient-centered medical home services. Another thing we do, and we do it at our downtown clinic, is we rotate specialists in the clinic. So maybe people have transportation issues, or they have scheduling with their job and they can't get off certain days. They can't take 3 buses to get to a specialist, or they're not comfortable going into another environment. We will actually have the specialist come into the clinic, usually monthly. They'll rotate into the clinic, and they'll actually see the patients in our medical clinic where that patient is comfortable and is more likely to show up, come, participate, and learn about the different care that doctor is going to be providing them. So let's see now. I've talked about a lot in the first 5 minutes of this show. I've talked about our name change because we're getting bigger and we're expanding and our resources are more plentiful. I talked about federally qualified healthcare centers, which I've done on previous shows. And I've also talked about patient-centered medical home and the quality levels and the collaboration that is required for patient-centered medical homes. So let's break it down a little bit slower, because I know I jumped in feet first, as usual. A federally qualified healthcare center actually has to meet 21 requirements to be a lookalike and 19 to be a grantee. So those requirements primarily rotate around hours of operation. It's encouraged that the hours of operation should be outside normal 9 to 5 business hours to help people who work or have different shifts, to help people who can't maybe get there until after school. So First Person has Tuesday evenings and Saturday mornings as their extra hours. Most of the time, most federally qualified healthcare centers will have at least one evening hour during the week, sometimes more, but at least one. So you should look for that, because that may be what helps you choose your provider and the programs that they have. Also, federally qualified healthcare centers deal with constant quality improvements. It's not enough to say, oh, we meet these quality standards. In fact, continual quality improvement is basically the mantra of these organizations. So they're always looking for what's better out there, what's more improved, what's the latest in healthcare for diabetes or hypertension, what kind of education classes do they provide. A lot of the FQHCs will provide HIV, hepatitis, hypertension, diabetes. So they'll provide these education classes, nutrition classes, and parenting classes. So you'll see these classes also being integrated into these federally qualified healthcare center medical clinics. And that's really important, because the majority of these classes are free to our patients. And they also provide that extra level of information in caring that helps the patient really be able to commit to the care program that their doctors are working with them on. So when you find out that you're diabetic, it's not enough to cut out sugar and carbs and give yourself an insulin shot. It's a real way of life change, and it's not a death sentence. You can actually learn to take care of yourself and your family and weed yourself off, to wean yourself off some of this insulin. I have patients every day who go from taking 3 insulin shots to 2 insulin shots, who've lost weight, who have had their A1Cs, which is their sugar level in their blood, reduce because they've changed their way of life. They've gotten healthier. They've cut out certain foods. They've increased other foods. They've exercised, and they're more conscious of what they're putting in their body. In this day and age of fast food and immediate gratification, sometimes it's hard to think, wait, let's take a second here and do something fresh. Fresh sometimes is just as easy as driving through, and to do something that makes you feel good. I'm almost 50, not quite, so we're not going to bury me yet, but I'm getting up there. I'm on the sunny side. And I've really, in the last, say, 4 or 5 years, made a conscious effort to look at what I'm eating, to actually provide myself a healthier, balanced meal. And I know it took me a long time. You're like, why did you wait so long? Well, I fell in the same trap most parents and most families fall into. You run from school to the games for the kids, to homework, to this, to that. And you really, if you don't plan out in advance, you find yourself just grabbing on the go. So yes, I am a victim of that as well. But I have made a point of Sundays, I do a schedule of what we're going to eat for the week, and I will make meals and prepare them in advance and stick them in the refrigerator or the freezer, and then pull them out so that we can eat something healthy on the way. And then I've also, crock pots are my friend. Love crock pots. So all these things provide us with healthy, good meals. But what I found, and that was my rampage, what I found is that when I do grab and go, when I do stop through one of those drive-thrus and I pick something up, I don't feel good afterwards. I feel tired. I feel sluggish. I have no energy. And it's real apparent to me that I've put something not good into my body. And I'm not saying I'm special. What I'm saying is that if we all consciously cut out fast food for just a month, don't do anything processed or fast foody for 1 month, and then you go eat something that's fast food, you will feel the difference. And then it becomes really apparent, why were we doing this all these years? So this is what I've done. And I actually get very excited about it. I've gone so far, I've kind of gone over to the dark side of healthcare. So I now have protein shakes in the morning, and I eat balanced lunches, and I've cut down my alcohol intake, and I've done all these things and I don't know if it's completely in vain, but it's so that when I do get older, because that seems to happen whether I like it or not, that I feel young and I look young, because we're all a little vain, and that I have the energy to keep going and to do what I always want to do. The last thing I want to be is, I'm so tired and it's 8:00 at night. Let's go to bed. So I'm going to fight that tooth and nail. So the health and the education that's provided in the FQHCs is phenomenal because it gives people that support network. You can do it one-on-one, but I really encourage to do the education classes, because then you make friends and you're going through the journey the same, and you're actually at the same time, and you're actually developing this support network of people that you can cheer on and help up when they fall, because we all fall from time to time. And it makes the journey of getting healthier and treating yourself better more satisfying when you can do it with other people. And if you're a little competitive, which I am, then you always like that edge of, well, if this is the status quo, I want to do a little bit better. If everybody is losing 2 pounds, I want to lose 3. If everybody is jogging 2 miles, I want to do 3 miles. So it's that kind of whatever motivates you type thing. But I think once you start and you get through that first few weeks, it'll be easy to not look back and to want to be a better, healthier person. So federally qualified healthcare centers are not just doctor's offices with exam rooms. We actually help and promote and work with our patients to have that level outside of the clinic. We also work with them on, immunizations and pediatrics and parenting, and helping parents make smart decisions and giving them the resources to be able to make the best decisions for their children. A lot of young parents out there don't necessarily have the support system that some people do have. So you want to make sure that they have all those resources available to them. Another thing that our particular federally qualified healthcare center does, and this is unique to us, so I wouldn't say that this is something everybody does, but we are non-narcotic prescribing, which means when our patients come in and they have pain, the last thing we're going to do is prescribe a narcotic. We're going to talk to them about exercise. We're going to talk to them about diet. We're going to talk to them about using back braces, acupuncture, meditation. We have patients come in with anxiety issues. We actually have trainers come in and teach them how to meditate, how to relax themselves, how to put themselves to bed. We work with patients that have pain, and we'll provide acupuncture, or we'll work with them on using back braces and TENS units and other alternatives. We'll also talk to them about developing core strength and exercising. If they have neuropathy in their feet, we talk to them about their diabetes and A1C and the different products that are out there that will help them so they don't have nerve pain. So we want to help the patient allow their body to heal itself, and for that patient to become naturally strong. So the last thing we want to do is throw a pill at it, because that just masks the issue. That doesn't resolve the problem. So one of our big things, and it's a little longer of a journey, but it really, in the long run, allows the patient to take control of their body, to take control of their situation. And that's really what we're going for here, is the patient needs to be in control of themselves. And the patient needs to allow their body to work at its optimum. And our bodies are designed to rejuvenate and to replenish and to strengthen ourselves. So we look at all those aspects before we'll sit there and talk to a patient about any kind of pain medication or pain management. And when it does get to that area, we'll usually send them to a specialist, because it's become a very specialized industry, and it's a slippery slope for doctors that will prescribe one-off pain meds. So we really want to make sure that that patient's getting all the accurate information. And part of that accurate information is working with specialists or working with physical therapists. So we'll work with them on making sure that they get that information. Another thing we do at our particular clinic is we have behavioral health integrated into our medical clinic. So when our patients come and say they're having just a natural life cycle changing event, and it could be something as simple as turning 50. It's kind of traumatic to some people. I'm trying to be tough about it. Some people have birthdays are traumatic milestones, or there's a marriage in the family, very stressful, or there's a death, even more stressful, or there's somebody who's ill, or there's a caregiver, or your children just moved back home because they can't afford the apartment, or they're lost a job. So all those life cycle moments actually are part of our mental health, and they actually can manifest into physical issues. So we actually have students and therapists in the clinic to talk to. And they are actually integrated into our whole network. So when you come in and the medical assistant checks you in and triages you and gets you ready for your room, we ask questions about life cycle and smoking and drugs and what's going on in your life. And we're kind of nosy, but good nosy, because we want to know, is there something that's going on in your life that we can help with while you're here? And if there is, we usually will have one of our behavioral students or clinical licensed psychiatrists or counselors come in and talk to you while you're waiting for the doctor. It makes the time that you're waiting for the doctor go by a lot quicker, but it also gives you an idea of what it's like to talk to somebody. And then you get to determine afterwards, was this something of value? Did I enjoy it? Did it relax me? Does this person have some insight that I really need to bounce ideas off of? And then from there, you can determine if you want to follow up with that person later. We like this approach because I think a lot of people, if you say, listen, you should talk to somebody about, your children living in your house, or you should talk to somebody about your husband's diagnosis. People get a very standoffish approach, and they're like, I'm all right. There's nothing wrong with me. And why should I talk to somebody? But talking to somebody is very cathartic. And I don't care if you do it at Starbucks, or if you do it with your religious leader, or you do it with your best friend, or you do it with a counselor. Talking to people really helps you reason out and move through things. And that's all really the behavioral health or mental health is all about. We all have it. We all have ebbs and flows in our life, and we all have times when, you know what, just talking to somebody or just having somebody listen is very helpful and helps us reason and go through it. So, and then also, they also help with resources, what's available, what's out there. I had a woman in the clinic who found out that her husband was diagnosed with Parkinson's. He needed to have a caregiver. She was going to be that caregiver because this was her husband for 40 years. So there was nobody else that was going to step in. And of course, you would think that way. So we focused on not necessarily the husband and the Parkinson's because he had specialists and he had people around him. We focused on the caregiver. And that's really important too, because the caregivers wear themselves out. They think they're invincible. And we want to make sure that the caregiver gets just as much support and just as much help as the patient themselves get. So that's one of the things we do at our clinic with the integration of behavioral health. We also have some fun things, like we have an infusion suite and we have x-ray machines, and we're looking at expanding. So here's the drum roll for why we're changing our name from Healthy Las Vegas to Healthy Nevada. I would say probably in the next 6 months, we will have a clinic in North Las Vegas. And then from North Las Vegas, we'll have some sub-clinics, smaller once a month type clinics throughout the city of Las Vegas. And I want you to know that not only our clinic, but the other federally qualified healthcare clinics that are totally sprinkled throughout the entire state of Nevada up to Reno and to Carson City also have phenomenal services available. There's a clinic up in Reno that specializes in infectious disease and HIV, and they do primary care, and they are phenomenal, opening up a new big building up there to help people with rehabilitation. So it's more than just a medical clinic, and we're definitely not the free corner medical clinic. We are a full-fledged medical clinic that works in a group atmosphere that provides team collaborative support to the patients, that provides an extremely high quality level of care, but does it at a reasonable price that people can afford, whether you're insured, underinsured, or uninsured. And what I mean by underinsured are you people out there who have really high deductibles that you'll never meet in a single year. Those come to us because we have resources to help you still see a doctor and not have to pay through the nose. We want to make sure you get that preemptive care in advance. But we also have specialists. There's a medical clinic here in town called Nevada Health Centers. That's a federally qualified healthcare center that has OBGYN and pediatrics in-house. So that's their niche and where they specialize. They also have a dental program. So there's opportunities here for these federally qualified healthcare centers to really meet all your patient needs. And that's what we want to really emphasize. High quality costs that people can pay without being in debt or having it be a burden, access to everybody, and everybody is accepted. There's nobody out there that wouldn't be accepted unless you're nasty. I don't like nasty people. So we're just like a medical clinic like everybody else. We respect our patients. We expect our patients to respect us. And that's really the only rule we have at First Person. You can't come in and yell at my staff. That's a no-go. I understand frustration, and I understand people who are really feel like there's nobody out there for you, but there really is. And they're called federally qualified healthcare centers, and we're out there for you. If you have any questions, you can call 702-380-8118, option 3, and we'll be able to help you answer your questions. And I also have the State of Nevada Primary Care Association at nevadapca.org, and they can actually help you as well. So welcome to Healthy Nevada, and I hope you've learned a little bit today. And next week we'll have somebody on so you won't have to listen to me talk for the entire half hour. Have a great day. This is Tina Drago with First Person Complete Care, coming to you live from Studio A at Beasley Broadcast. This is Healthy Nevada.